The Indigenous Community Support Fund is an accessible and flexible stream of funding that can rapidly provide financial support for communities to prevent or respond to COVID outbreaks. Every First Nations community is eligible, and I encourage communities to reach out to the department if they need additional support. This COVID surge that we're currently facing is difficult for all people across Canada. And I know everyone is exhausted and everyone is working so hard to keep safe and to protect our loved ones. And like previous waves of illness, the biggest challenge is not money or equipment. We have the capacity to quickly respond with necessary items and financial support wherever and whenever it's needed. The larger challenge remains, and it's been worsened by the sheer infectiousness of the Omicron variant and the exhaustion factor of the many health professionals, cleaners, people supporting communities, and other essential workers. Health systems and communities right across the country are strained, and more infections means more people in isolation, often significantly threatening essential activities and services. And that's why it's so essential that we continue to do everything we can in our power to lessen the impact of illness, and that we each do our part. So what can we do? We can get vaccinated, we can support others to do so, and we can continue to follow public health guidelines that reduce our likelihood of coming into contact with the virus. But unfortunately, even with these precautions, some of us will become ill, and some of us will need to isolate. And of course, in very small communities, that can pose a risk to the everyday functioning of families, compounding the very difficult nature of the outbreak. And as cases rise nationally, they are also rising in Indigenous communities. And of course, some communities continue to face ongoing challenges of remoteness or fragile infrastructure, which worsens health crisis very quickly. I know many of you and others across the country are following the outbreak in Bearskin Lake, as the community had a very high percentage of residents testing positive. The good news remains that there have been no significant illnesses, hospitalizations, or deaths associated with this outbreak, and the numbers of people sick or isolating are dropping quickly. This means families and individuals are becoming able to resume their daily activities and roles, and I'm sure this is a huge relief to the leaders and to the members of the community. I also want to commend the residents of Bearskin Lake for their efforts in getting vaccinated and following public health measures, because their efforts have blunted the severity of the virus and prevented that severe illness and death in their loved ones. Since late December, our team has been in daily contact with Bearskin Lake leadership and worked with the many partners supporting the community, including Wendigo First Nations Tribal Council, the Sioux Lookout First Nations Health Authority, and other partners. Indigenous Services approved more than $1.1 million in emergency funding in the last week of December and first week of January to help with PPE and other prevention supplies, food security, wages for community-based workers, community and perimeter security personnel, and associated costs, and for the safe transportation by air of volunteers and other paid service providers. And upon the request for military assistance from the province of Ontario, Canadian Rangers are also on site and helping the community to meet its needs. Over the past 2 weeks, Indigenous Services has helped to facilitate and financially support the presence of dozens of personnel, including 3 primary care nurses from Indigenous Services, 1 advanced care paramedic from Indigenous Services, 2 rapid response environmental health officers, also from Indigenous Services, 12 Bearskin Lake community members from Thunder Bay, 2 Community Disaster Relief Ontario employees from NGO Alliance, 3 Team Rubicon members, 2 public health nurses from the Sioux Lookout First Nations Health Authority, 1 home care nurse from Wendigo First Nations Tribal Council, and 28 Wendigo Tribal Council members and 6 community members paid for by funding from Indigenous Services. We're continuing to coordinate supports to meet the ongoing needs of the community, and I would say everyone's focus remains on the health and safety of the residents of Bearskin Lake as people increasingly recover. Now, as of yesterday, there are around 47 active cases, and as I mentioned, there have been thankfully 0 hospitalizations. Earlier today, I spoke with Chief Kamanawataman to reiterate our support and to continue to ensure an open line of communication. He's cautiously optimistic about the recovery of the members of his community, and I wish him well in his own personal recovery. There are other communities the department is supporting in Northern Ontario as they work to protect their members from the growing spread of COVID. Our officials continue to meet regularly with the communities and leadership to provide support and address any requests quickly and efficiently. In my own riding, I recently spoke with Chief Towedo of Araland and Chief Taylor of Ganoogaming, both who have faced growing cases and are working incredibly hard to protect their communities. And of course, I regularly stay in touch with Anishinaabe and Matawa leadership. On Monday evening, I met virtually with a number of Manitoba chiefs, and the message was clear that although community leaders know that supports are available, they are asking that we reduce as much as we can any cumbersome request processes. My officials heard the calls for this efficiency, and we're working on ways we can streamline processes even further. Manitoba First Nations are also seeing a quick rise in case counts and are taking measures ahead of potential outbreaks due to the Omicron variant. In Manitoba, Indigenous Services has funded the creation of rapid response teams through the Ongo-Mizawin Health Services at the University of Manitoba. Their efforts focus on vaccinations, primary care, testing capacity, and public health case and contact management, depending on the needs of the community. Indigenous Services also has provided training and guidance on contact tracing to health professionals in all First Nations communities in Manitoba and has a team of public health nurses available to assist in all communities with advice, guidance, as well as chores like administering COVID-19 vaccines to community members. Other regions are also seeing quick escalations of cases in Quebec, Saskatchewan, and the North. We continue to monitor the situation in each region, and we'll provide supports as communities work to protect their members. Now, this virus is capitalizing on the major inequalities that have existed in First Nations, Inuit, and Métis communities for generations: overcrowded housing, access to health services and professionals, food insecurity, and more. With COVID, we have to work immediately to address outbreaks and respond to this very quickly moving virus, as we've shown in our pandemic response over the past 2 years now. But as Minister of Indigenous Services and as the federal government, we also need to work with partners to work faster on addressing long-standing gaps that create a foothold for illnesses like COVID-19. Housing, water, infrastructure, healthcare capacity. These are all areas that we must continue to urgently address for the better health of all Indigenous peoples in Canada. I look forward to working across all levels of government to more rapidly address these ongoing inequities that, once addressed, will only strengthen communities and indeed our entire country. Finally, I want to thank the many partners, and in particular, Indigenous leaders who have helped to vaccinate so many people. It's clear that vaccines are preventing severe illness, hospitalization, and death. Some people have been reluctant to get vaccinated, but we can all play a part to help protect each other. It's not too late for anyone to get their first dose of the vaccine. And please get your booster shot when it's your time. By doing so, you're protecting everyone you love from severe illness, a true act of love. Miigwech, merci. Thank you. I'll now pass it over to Dr. Wong.